Welcome everyone to the next lecture in the Turnaway study series. Today I'm going to be talking about socioeconomic outcomes of women who receive and women who are denied abortions in the United States based on our data from the Turnaway study. The recommended reading for today is the one that's in larger font. This is the paper about women's self-reported socioeconomic outcomes. And it's the data that will be the basis for today's lecture. The next two also deal with socioeconomic outcomes, but they're for the women's children. So the first is for existing children at the time she sought abortion. The second is what happens in terms of economic well-being to children born later, either because she was denied an abortion or from a subsequent pregnancy. And the third paper is, will have its own lecture by my colleague, Sarah Miller, who's a professor at the University of Michigan, based on linking women from the Turnaway study to their credit reports. So check that out, it's a separate lecture. So just to review, the reasons for women give for wanting to terminate a pregnancy. The number one most common reason is that people feel like they aren't financially prepared to have a child or to have another child. And so it does lend the question, what are the consequences if women are unable to get that abortion? And given that it's the most commonly stated reason, we might expect to see that there are economic consequences. Again, just a review of the Turnaway study design. We recruited 3 types of women from 30 abortion facilities across the country. We call one group Turnaways. They were over the gestational limit within 3 weeks and they did not receive an abortion there. Women who were just under the gestational limit, we call near limit abortion group, and they received the abortion. And then because most of these sites had limits in the second trimester, but most women who have abortions nationally are in the first trimester, 90% or so. We also recruited a first trimester sample. So we ended up recruiting 956 women between 2008 to 2010. We followed all women for 5 years, calling them every 6 months for phone interviews. The study flow shows you the green. I'm going to try and keep the colors green for turnaways and blue for near limits, and we're and orange for first trimester. So in this analysis, I'm going to show you graphs, and I give you the baseline value on the graph, but those baseline values are not part of the model. Instead, you put into the data all observations starting 1 week after being, 6 months after being denied or receiving an abortion through to 5 years, controlling for the baseline value, which we measured at 1 week. And the reason we had to do that for this analysis is that there were some baseline socioeconomic differences, so we are controlling for those baseline differences. There were some differences by study group, and some of those differences are not. Remember, this baseline value was 1 week after either receiving or being denied an abortion, and it's possible that some of what seems like a baseline difference is actually responding to the fact that they now know they're going to have a baby, or they know they're not going to have a baby. So, but we treat these as if they're real differences. It makes for more conservative analysis. And when I show you graphs, the shaded areas indicate that there's no statistical significant difference in the predicted values for the near limit and turnaway group where it's shaded. So how does receiving or being denied an abortion affect women's household structure? I tried to put a quote from one woman from each of these just to say how women worried about either receiving or being denied an abortion, how that would affect household structure. So this woman, 19-year-old from New York, said her reasons for abortion were financial, providing and having a place to live. She and her mom live in a 1-bedroom apartment, and she didn't feel it was appropriate to move in with her boyfriend and didn't feel ready to raise a kid like that. So what does happen with household structure? This is a model where the outcome is numeric and just a count of number of people in the household. You can see there's no difference at 1 week, but the model shows that in fact there's then a gap of almost exactly one person at half a year, which very likely corresponds to the birth of the baby. And that slowly over time the two groups converge, but still it remains statistically significant at 5 years. So you could wonder for Turnaway births, why is the number going down? And I'll show you what that is what's going on. Here's living with a male partner, and the entire graph is shaded. At no point does one group have higher or lower odds of living with a male partner from 1 week through 5 years. I think that's probably super shocking for people who would think that having a baby would make people move in together or keep people together, couples together, and that doesn't happen. And in part, it's because women already have reported that they don't feel like the relationship is strong enough to raise a child with the man involved. So it's less surprising that they're not deciding to immediately move in together. So no differences when living with a male partner. Here is residing with adult family members. So you can see at baseline, there's a big difference in the statistically significant difference. This could be a 1 week later, they've moved back in with their parents. I don't know, but it is statistically significant. We controlled for it. And you can see that controlling for baseline differences, there are no differences until you hit year 4, at which point turnaways are actually, women who gave birth after being denied an abortion are actually less likely to live with adult family members like parents and grandparents. Here is the chance of living without a male partner or adult family members. So this is in effect raising children alone. And at 5 years, the women who are denied an abortion are more likely to be raising children alone. So how does receiving or being denied an abortion affect employment? And a 28-year-old from California said her reason for abortion was, my husband and I haven't had jobs in a while and I don't want to go back to living with other people. If we had another child, it'd be an undue burden on our financial situation. Here's what happens to full-time employment. There is a difference at baseline. Controlling for that, there's still a difference that remains through 4 years in the odds that a woman has full-time employment. It ends up being 60% lower odds of working full-time for women who are denied an abortion compared to receiving one. The converse, not working at all, the difference between full-time employment and not working, the only other option is part-time working, and there's no difference in part-time working, but there is a difference until 3 years where women who were denied an abortion and have a baby are more likely to not be working, even controlling for the baseline difference. And in fact, the coefficient on the multivariate model shows a 3 times higher odds of not working after the birth of the child. How does receiving or being denied an abortion affect receipt of public assistance? And a 19-year-old from Washington State said, I don't have money to support a child and I don't want to get support from the government. Here's receipt of TANF. This is what is casually referred to as welfare. Absolutely no difference in receipt of welfare at 1 week, and huge and significant differences between women who are denied and women who receive just under the limit over time. The sharply decreasing line for women who gave birth doesn't necessarily indicate that they became wealthier and no longer qualified, but many welfare programs actually have term limits, so you can max out the number of years of support and no longer be eligible. 6 times higher odds of receiving TANF if they're denied an abortion compared to receiving one. Receipt of food stamps, no significant difference at baseline, but constant higher odds of receiving food stamps for women who are denied an abortion. And the steadiness of the difference here is, in my mind, indication of continued economic hardship and difference in economic hardship, because there is no timing out of food stamps. This is a better indicator of poverty and economic hardship than receipt of welfare is. So 2.5 times higher odds of receiving food stamps after the birth of a child if you're denied versus receiving an abortion. So income and poverty, a woman from the Dakotas said her reasons for abortion were all financial, not having a job, living off death benefits, dealing with a 14-year-old son. I didn't have money to buy a baby spoon, she said. Here's household income. So we saw that there were drops in employment. These don't translate to total drops in total household income. And that's partly because those loss of employment dollars may be made up for some in public assistance. There's also imperfect reporting of household income. And I refer everyone to Sarah Miller's fantastic analysis of credit reports, which doesn't rely on self-report to give a longer-term trajectory of economic well-being, and also to show that in fact there were no statistically significant differences between women who received and women who were denied abortions before they became pregnant. The first data point I have here is 1 week after they received or were denied, but Dr. Miller actually has data for 3 years before they even became pregnant. No differences in total household income from the statistical models, but the no difference in income, but a bigger family size means that women are more likely to fall below the federal poverty level. So no differences in the chance that the family lives below the poverty level 1 week after being denied or receiving an abortion, and sharp differences thereafter that converge somewhat so that the difference is not statistically significant by 4 years. So 4 years of an increased chance of living in poverty if you are denied an abortion compared to this is subjective poverty. So we ask people, do you have enough money? How often do you have enough money to pay for food, housing, and transportation? You can see no difference at 6 months or even 1 week, but thereafter, women who are denied abortions are more likely to say that they just don't have enough money to pay for basic living needs compared to women who receive an abortion. So conclusions on the socioeconomic findings: compared to receiving an abortion, being denied an abortion is associated with a loss of full-time employment, increases in receipt of public assistance, a greater likelihood of living in poverty, and insufficient support from family and partners, at least in terms of raising a child living together. So a couple thoughts. The most important is that we ask women why they want to have an abortion. They say they don't have enough money to pay to support a child. We see clearly in the data of women who are denied abortions that they're right. Raising a child is expensive. They knew it would be, and when they're unable to get an abortion, they're much more likely to be poor and to experience not having enough money for just even food and housing and transportation. And these differences are large. There are large economic differences that we can expect when women are denied a wanted abortion. And the supports that the government gives in terms of public assistance, employers maybe in terms of flexibility for working while having a young child, community supports in terms of providing food, and family supports are just not sufficient to keep women and children from poverty. We have this little window into how insufficient our social support system is from this data set where women were denied an abortion, but it is true for women having wanted pregnancies who are low income that many of the at least government supports are insufficient. Now, women who choose to carry a pregnancy to term may understand that they have more family support, greater community support, other resources. So just being low income doesn't mean that you're necessarily going to become poorer if you have a baby, but it does indicate that we have a completely insufficient social support system for low income moms. If you have questions or comments about this lecture, please email me. Thank you very much for joining.